The question is it normal for me to have pain during sex? Is painful sex normal? Today I'll be talking about painful sex in women. If you are just joining this channel, don't forget to like, share, and comment, and you're welcome. And if you're a returning subscriber, I love you. My name is Gwendolyn Hale. I'm a seasoned and certified medical microbiologist, and I'm popularly known as the medical professional with the difference. Thus, I bring you knowledge to your doorstep at the comfort of your living room. And I do it like no other. Let's go there. Welcome back. Into this class, I'm going to be teaching you 29 reasons why you have painful sex. 29 reasons of painful sex, or causes of painful sex. Painful sex is also known as dyspareunia. There are two main causes of painful sex, or dyspareunia, or pain during sex. And that's the physical and the non-physical. But we'll start with the non-physical that has to do with our emotions. And the first is ladies who have been raped. If you have been raped and you're trying to have sex later on after the experience, you will find out that you are not comfortable. The trauma from the experience of rape would actually cause you to be experiencing pain during sex. The next is scared of getting pregnant. If you're scared of getting pregnant, getting an unwanted pregnancy, you're obviously going to be experiencing pain during sex because your pelvic floor is tightened. The third is stress. Also tightens your pelvic floor. And the fourth point is if you are angry towards your partner, if you are not comfortable with the partner that you're having sex with, you're going to be experiencing painful sex. The next is low self-esteem. If you're a lady who is conscious about, let me say, the state of your boobs, if you're put on weight, or let me say your genitals or your nipple area or anything about your body, stretch marks, you realize that because you are not relaxed, because you're under tension or your body is tense, you will be a little bit rigid during sexual intercourse and you may end up having painful sex. Now, the next point is anxiety. When there's anxiety, when there's depression, there is no secretion of fluid or seminal fluid by the Bartholin gland. The Bartholin glands are very close, small openings just close to the clitoris, and they are very important in actually secreting this seminal fluid that actually lubricates the vagina and aids easy penetration and makes sex enjoyable. So these are the non-physical causes of painful sex. Now let's go into the physical causes of painful sex. When we are talking about the physical cause of painful sex, we are looking at two: the superficial and the non-superficial. That means the superficial, that means what happens just around the opening of your vagina, the vulva, and the non-superficial, that means deep, that means right inside the vagina towards the cervix. So this is what we're looking at. And the first, we're going to start with the superficial. That's the pain that occurs around the vulva, the opening of the vagina. The first is vaginal dryness. And we're looking at vaginal dryness. We're looking about if you have hit menopause and your estrogen levels drop, know that you're going to be experiencing a lot of vaginal dryness. Remember, estrogen is very important to, increasing sexual appetite in a woman. And the next is if you're using yoni pearls, alum, cloves, and other concoctions to douche yourself, to do vaginal douching, to pump into your vagina, to actually tighten, as they say, you end up having vaginal dryness. So when you have vaginal dryness and there's penetration during sexual intercourse, what happens is the opening of your vagina, the vulva area becomes very painful. And if you're not careful, you're going to have vaginal tears and you will bleed during sex. The next point is genital injury. If you've had any form of genital injury, let me say while doing a sport or while giving birth, you are going to be experiencing this painful sex. The next is vaginismus. Vaginismus is when the muscles in or around the vagina contract and prevents the penetration of the penis. And this is common in some women. There are some women who actually are not able to have sex because of this problem, and there are some that are only able to allow the penis only enter just a tiny bit. That means a man cannot have full penetration. He will only be able to penetrate the opening because it will be extremely painful. And mind you, there are different degrees of these vaginismus in women. That is why most women who are experiencing constant vaginismus would have an IVF and give birth through C-section. That's what happens. The next is inflammation. That if you have a pelvic inflammatory disease that is causing you or your spouse not to penetrate you properly, or causing penetration very difficult, you have pain. If your vulva is inflamed in any way, you are going to be having this painful sex. Next is infection. If you're having thrush or any form of genital warts, for example, that affects your vulva, because thrush affects the vulva, sometimes inflames the vulva. It causes a lot of itches, and vaginal warts actually are like small growths that are around the vulva. So during penetration, it's going to be very painful, and the woman will be experiencing painful sex. The next is urinary tract infection, and we are talking about the first stage of urinary tract infection, where when a lady wants to pee, she's having a burning sensation. It also causes, remember, the the bladder, the urethra, the anus, the vagina, all of those passages are closed together. If you look at the female reproductive organ, they are close together. So if one is affected, it will obviously affect the other. So this urinary tract infection causes the urethra or the bladder to be inflamed, or the opening of the urethra to be inflamed. And during penetration, there is a lot of pain. So bear that in mind. The next on our list is irritants. That is, if you put any form of concoction, for example, as I mentioned, alum, cloves, or yoni pearls into your vagina. You have also irritants like that come from soap, vaginal perfumes that people use, and when you spray it around that area, it may irritate that your vulva and cause it to be inflamed, and that inflammation will cause painful sex, especially when there's penetration just at the entrance of the vagina. The next is scarring at the opening of the vagina. When a lady has just given birth to a child and she has been stitched, that scarring, if it hasn't healed properly and she wants to have sexual intercourse, what's going to happen is she's going to be experiencing painful sex. The next point is an imperforate hymen, or a hymen that has a very tiny hole. That means abnormal hymens. I've done a video about hymens, and I think you should look at it. They are females who are born with their hymen completely shut. There are females who are born with a little opening on their hymen that prevents menstrual blood from flowing, and even prevents the doctor from taking a swab or any form of examination or collection of discharge from the female. There are some females that are born with little tiny holes on their hymen. So take a look. So if a lady has an abnormal hymen, when she wants to have sex, it will be so painful just at the entrance, because either she has no opening or the opening is very tiny. A vagina that is not fully formed. If you have a vagina that has not been fully formed, there are some females who their vagina, their cervix have not been fully formed. You're going to be experiencing painful sex. And this is for the superficial, that is just at the opening of the vulva. Now we are going to look at the non-superficial part, and that's the deep part inside the vagina itself towards the cervix. And the first on our list is constipation. Now, like I mentioned earlier, your bowels, that means your anus opening, your vagina opening, your womb, and your bladder, your urethra are, closely together. They are so close together. So when one has a problem, it affects the other. And we're talking about constipation. That's when your bowel is extremely full. And when you have a full bowel, it presses against the vagina and causes painful sex. Uterine fibroids. And this is for uterine fiber that go very close to the cervix or in the vagina. You're going to be experiencing a lot of pain, guys. Previous surgery, the next point. If you have had any form of previous surgery that had to do with towards your cervix or in your vagina and it hasn't healed properly, and even when it has healed, sometimes the scarring may take a long period of time to actually level itself out, you'll be experiencing deep, painful sex. That means extreme pain during sex. And next is if you have any form of medical condition such as polyps or tumors that grow in the uterus or around the cervix, you're going to be experiencing a lot of pain when you're having sex. The next is endometriosis. I did a video on this, I think, when causes of heavy period. You should look at it. There's endometriosis, there's adenomyosis. If you watch that video, it's so insightful, so rich. So back to this topic, endometriosis. This is when tissues that are supposed to be found in the uterus begin to grow in the fallopian tube, in the ovaries, or outside of the uterus or of the womb, and this is what we call endometriosis, and this will cause painful sex to a very high degree. The next is polycystic ovary syndrome, polycystic ovary syndrome, ovarian cyst. This also is a medical condition that causes painful sex. So if you have any of this I am mentioning, please do see your doctor. If you experience any form of painful sex, run to see your doctor. Pelvic inflammatory disease. This could be caused by sexually transmitted diseases, other form of infections that may have happened in the vagina, in the womb, and they have not been treated on time. They have moved from the primary stage to the secondary stage and even to the tertiary stage, and they cause scarring in the woman's body, either in the vagina or in the womb. So during sex, there's going to be a lot of pain, especially at the lower abdomen. You're going to be experiencing a lot of pain. The next is cystitis. That is the inflammation of the bladder. Cystitis. When the bladder is inflamed due to microorganisms, it could be a bacteria, it could be a fungi, it could be a virus, that's going to cause painful sex. Remember, as I said, your anus area, your rectum area, your bladder, your urethra, your vagina, are closely located together. So when one is affected, it would affect the other. So when your bladder is inflamed, it will put a lot of pressure on your vagina and it will cause pain, deep pain during sex. The next is irritable bowel syndrome. This is a condition that affects the digestive system. And trust me, it greatly affects the reproductive system because they are closely linked together. The next is pelvic floor dysfunction. Pelvic floor dysfunction could occur when a lady has just given birth and, her pelvic floor may move. There are a lot of conditions or problems that may cause the pelvic floor to be dysfunction or to be displaced. So when this pelvic floor it's not functioning properly the way it's supposed to function, you have painful sex. The last point on our list is ectopic pregnancy. Ectopic pregnancy is very common with ladies who have done an IVF. So if you have an ectopic pregnancy, if there's a fetus or a baby growing in your fallopian tube, you're going to be experiencing painful sex. I would like to draw your attention to this. In any form of abnormality or infection that happens to one area of your reproductive health affects the other. Any form of infection that affects your anus, your rectum, or your bladder, your urethra will affect your vagina, will affect your womb in one way or the other because they are closely linked. Now, like I mentioned before and I've always mentioned, please be conscious of your reproductive health. Be conscious of your sexual health. Don't wait till you are about to get married or you're about to have children before you start running helter-skelter from one clinic to another, one doctor to another. Most people who are having problems having kids today actually had a minor or first degree problem when they were younger and they ignored it. They either had an abnormality that they discarded or they put aside or they didn't care about or they didn't want to bring that to their attention because they felt that it was of no importance, and it caught up with them while they got older or when they were of age or when they were of childbearing age. So this is for both men and women. Preserve your fertility. Protect your fertility is a must. And this comes with our parents or older ones educating the younger ones on how to take care of themselves. I will hammer on this day and night. Protect your sexual health. Protect your reproductive health. Teach your young girls at the age of 10, 9. Teach them how to clean themselves. Teach them the basic hygiene. Start with basic hygiene. When they get to puberty, teach them how to examine themselves. This is very important, guys. So thank you for joining me in today's class. Thank you for all your questions, all your comments. Thank you for your love. Thank you for taking me along with you in your journey. Thanks for joining me in my journey as well. Thank you so much for your love, your hugs. Thank you for your support. Thank you for all your inbox messages. I will never have been this far without you. I love you so much. God bless you.